So something else that we really must discuss is the stages of cancer. There are different stages, and people get diagnoses at very different stages. Maybe what are these stages and what exactly do they mean?
Yeah. So you must understand that staging is different from grading. We grade cancers depending on the aggressiveness of the cells to become cancer. If you have a pathology report, you look at how those cells have been categorized, then you're able to tell whether this cancer is aggressive or it is not aggressive. That helps the doctor to understand what kind of disease they are dealing with, whether they anticipate disease progression to be sooner, or maybe the person will have a longer life to live depending on the level of aggressiveness. And then staging is based on the extent of spread of the disease from the primary site of origin to any other areas of the body. The primary the primary way that a cancer spreads usually is through the lymphatic system. So usually we'll have a tumor spreading to the lymph nodes, nearby lymph nodes, before it spreads to other areas of the body, likely the lungs, the liver, the brain, and the bone. Those are the areas of primary interest as far as metastasis is concerned. Yeah.
And that is what gives us stage 1, 2,
exactly.
3.
So stage 1 disease is localized. You could have localized disease. Actually, stage 1, 2, 3 is localized or advanced disease. Then stage 4 is metastatic. So stage 1 up to 3 is curative. The treatment is curative. We treat the patient to cure them. Then stage 4, it is palliation. Palliation because cure is impossible when the cancer affects the liver, the lungs, the bone, and the brain. So usually we palliate the patient depending on the symptoms they come up with. Yeah.
When you say that it is localized, you mean that if it is breast cancer, it's primarily just affecting the breast?
Exactly. So for localized disease, the tumor, it is just confined in the area that it started. It has not broken the barrier to other areas of the body. Once that is broken, then depends how far has it gone. Could be locally advanced, meaning it has spread regionally. If, for example, in the cervix, a lesion starts in the cervix, that is localized disease. Then it grows to involve the entire cervix. Then it involves the lower part of the uterus or the side walls of the pelvis. That is locally advanced. The metastatic is when it spreads out of the pelvis to other areas of the body. That is metastatic. But for local advanced, it's just right there. Yeah.
Thank you so much for that information. And mostly when someone gets a diagnosis that they have cancer, any type of cancer, they'll be told that you're in stage 1, stage 2, stage 3, or stage 4. And that will also influence the treatment, whether it is curative or it's more like managing it. But we have people who come to the hospitals with late stages and they cannot get really cured. Why is that? Does it mean that at some point you could have cancer and you don't have any signs and symptoms?
That is very true. And that's a typical picture of this population in Kenya or in Africa. We usually have poor health-seeking behavior. For as long as there is no pain, someone can stay with a lump for months or even years. Whatever shall bring them to the hospital is usually pain. And they'll start with self-medication, visit the pharmacist, get some painkillers, take some antibiotics here and there, until it gets really out of hand is when they come over to the hospital. By the time they come over, it's already metastatic. So that is because of poor health-seeking behavior, which is very common. Yeah. So depending where the lump is, we could live with it for 8 years before symptoms come up. Within those 8 years, I'm sure you've had self-medication, you've had so many things, on your own before you're seeking a doctor's attention, which is not a good thing. Yes.
And so that is something that we can really avoid if we learn to visit the hospitals if something is